Welcome back to Seeing the Need, Finding the Solution 2011 Stories of Healing and Hope, sponsored by People of Color Network and a variety of other contributors and collaborators in the Valley. Two special guests today. One has been no stranger, which is Tomas Leon, CEO of People of Color Network. Welcome again.
Thank you, Phil.
As well. And a new guest today, Mr. James Ali from Your Neighborhood Healthcare Centers.
Phil.
Welcome.
Thank you.
Tomas, let's talk about integrated healthcare and People of Color Network when you talk about My Healthy Living.
Absolutely. Well, we're focused on, our network is made up of clinics that we provide in the community and children's services, as well as nonprofit providers in the community that make up our network. We have what's called quality service providers, about 5 organizations that founded the network. And then we have a couple of dozen direct service providers who are nonprofits providing services. So we make up a behavioral health network, and now our People of Color Network is focusing on taking care of the whole healthcare needs of people.
And that network consists of some agencies.
We, some of the founding organizations are Centro de Amistad, Native American Connections, La Frontera Impact, Friendly House, and Ebony House. And so we collaborate together to serve the needs of people, children, families, and adults who are experiencing mental health and behavioral health challenges. And we do that by collaborating and integrating our services. Now we're moving into integrated physical and behavioral health care services, where we're focusing on the whole health needs of that individual, the mind, the body, the spirit. Can't separate those things. So it's important that we focus on how we provide and deliver that kind of coordinated care. And throughout the country and in Arizona, many providers and people in the community are trying to develop models and approaches of integrated care to provide the best care for an individual. And we've decided to partner with Your Neighborhood Healthcare Center to design and implement an integrated healthcare model in a community-based setting that provides this type of opportunity for people needing that type of care.
Real quick stat. Give me a stat when it comes to mental illness and life and expectancy, and before we cut to a PSA real quick and come back.
One of the things that people may not realize and understand that there's a national public health epidemic going on with folks who are experiencing mental illness. The life expectancy of someone experiencing mental illness is cut short by 32 years here in Arizona. The average life expectancy that's cut short by 25 years is the national average. And so when you have 1 in 4 individuals experiencing a mental health challenge and 1 in 5 children dealing with serious behavioral health issues, we have a public health challenge that we have to take on. The folks that are dying much earlier than their peers die because of a chronic health condition. So the correlation between mental health and chronic health conditions is serious, and it's something that we have to come together and collaborate on to address that. And we're doing that by partnering with Your Neighborhood Healthcare Center in ways that I'd like Jim to cover.
We talked last week about over $30 million in funding cuts over the last couple years, and how that affects people with serious illnesses, mental illness, behavioral health issues and challenges. Your network, I know we talked before, just to give people an idea how big you are and kind of how that looks. If you have a big TV network affiliate or network station, and they have all the affiliates as they go down through the different stations. That's how I kind of like to refer to People of Color Network. They're a network with a lot of affiliates underneath. A real quick answer, how much money and services combined do you think you guys do? I know I've asked you this before.
You bet. Well over $25 million in services we deliver.
So look at it this way. You got $30 million, $25 million in funding cuts. That's enough to wipe out your whole network. And it's very serious. Take a look at this video and this PSA.
We are people. So just think about it.
That's how serious it is. With that, Mr. James Ali, your neighborhood healthcare center. Welcome, James.
Thank you.
You've been a provider here in the Valley for quite a long time.
It's true.
Why don't you kind of piggyback off of what Tomas, I know you guys have spent a lot of time together over the last couple months, at least since I've been involved with you, but share a little bit about what Tomas is talking about with you guys.
Well, first off, YNHC was started as a community clinic where we went into an underserved community and developed a practice that would service those individuals that were not being serviced, both medically and psychologically. The practice has grown significantly over the last 4 years to now where it makes sense for us to get engaged with people of color to provide the behavioral health services, because comprehensive health care is necessary in virtually all cases. And so by bringing the People of Color Network in, we now have this umbrella of services that we can provide in these communities which are underserved by any standard.
Absolutely, and coming up with that idea from a lot of different angles and a lot of different meetings is the element. If you log on to stnaz.tv, or you can go onto evenaztv.com into the STN page, and you can actually fill out a form and apply for some of those services. We decided to be able to give away medical services to people who are suffering, primarily focused is in mental illness and behavioral health. But those have been denied services, and they really, really need some help. One thing I love about your company is this, and I don't, I've went through a lot of stuff in my life, but I've never met an office or another collaborator. Tomas talked about mind, body, and spirit type of thing, healing and that. And I've heard from interviewing some of the people at your office and doing some pre-work about allowing even the patients to pray, meaning if they want something like that. And that is so important. And I think so many people get hung up in the logistic aspect of stuff. But, when you've got that much money cut in funding, and people, it's really a matter of hope and losing hope. What more could be part of that medicine package than to provide them a little bit of help within themselves or what they believe in as well? How has that changed your view? I know it's got to be scary as a provider to kind of dance on the line or have people perceive it a certain way, but kudos to you guys. I've spoken to your patients. Let's take a look at a video from YNHC and show you how James interacts with his patients. Take a look. Last time your doctor high-fived you, and that was not staged. On your heart, up and above being a doctor, up and above being able to help people with a gift, why do you give back?
First of all, I'm a physician assistant, so that has to be said up front because I am supervised by a medical physician. With that said, I got into medicine for the purpose to give back. There are other ways you can make a living, but I haven't found any that's given me the intrinsic rewards as well as the spiritual reward of giving people the gift of healing, whether it be healing on the physical level, whether it be healing on the psychological, the behavioral level, or the spiritual level. Healing is healing, and it's necessary, and all human beings need that, and that's what's important to me.
I've had some surgeries, been to some doctors and some surgeons and Barrows neurological, stuff like that. But watching you interact with your patients, doctors come in a room, they go out of a room. They go in a room and go out of a room. I've watched you talk, spend time with them, smile, give a high five, but interact. And that is up and above a gift of healing to me. Not many people go that extra distance to do that. What makes you want to go that difference between you and the other physician's assistant?
I think that when you look at the whole person and you realize you're dealing with a human being, I think it's important that you connect, and that takes time. You can't just walk in and spend 2 minutes and walk out and expect to connect with that individual. And our patients are very loyal to our practice because we all, as a team, a medical team, and as well as a administrative staff, we connect. And they tell us that. And that's what it's about. And if you can connect, you can make a difference.
And Tomas, you always mention about that whole aspect. So why don't you jump in about treating that person as a whole?
Well, I think that's important. I mean, you have both the behavioral health side and the primary care side. And, you know, we're both passionate about serving communities and serving people. And wouldn't it be fantastic if you walk in your neighborhood healthcare center and you have the behavioral health professionals and the medical professionals working together on the same page, coordinating care, focus on improving the patient's health outcomes, and then really driven to do everything we can in partnership with them to improve their health and their quality of life. I mean, that's really what it's about for us, and really taking this to another level and doing things that are going to just improve people's lives in terms of their health and well-being.
And what Tomas is talking about is integrated health. It's bringing it together. How many times you go to a doctor and they have to send you over here for this, and then over here for that, and then over here for this, and then to a pain management specialist with a $600 consult when you have no insurance. That's for me, by the way. Anyways, when you get to that level, but how beautiful it is to walk in with your family care, your primary family care, your pediatrics, maybe a female OBGYN, your psychological, your psychiatric, and instead of people working apart, now you got people working together with the motive and the benefit of their heart, trying to sit there and focus on the person who still suffers. Awesome. We have about a minute and a half left. You've got a grand opening coming up with a new facility.
I do.
And that is?
That is December 1st at 5 to 8 at 444 West Osborne. 10 seconds. It's not, I mean, when people have a chronic disease such as diabetes, chronic pain, they develop psychological disorders. So chronic pain and chronic diseases kind of dovetail exactly what Tomas was talking about.
Awesome. Look for that grand opening on Osborne. Tomas, final, got about 30 seconds, 20 seconds left. What would you like to let somebody know when it comes to applying for maybe this free health care that they could use?
Well, I think it's important that that people understand that there is support and resources out there. It's important that people who are experiencing and suffering with mental illness and behavioral health challenges don't suffer in silence. Call our number, visit our website. We're here to help. We have partners that are coming together to make sure that we deliver the best integrated care out there for people who need it. So I ask that if you yourself or if someone that you know is struggling and suffering in silence, they are not alone. Take that step, make that call, and get the support that they need.
Tomas Leon, People Caller Network, that is POCN.com. Mr. James Ali with Your Neighborhood Healthcare Center. You can go to STNAZ.tv. You can go to aztv.com to the STN page as well. Take the advice, log on, fill out the sheet. It doesn't cost you anything. We'll be back with you next Sunday and next Wednesday. Take care.